Welcome to A Minute with Marty. I am Marty Haynes with HFC Insurance, and today we have one of Lancaster County's finest with us today. I have Dr. Crystal Maxwell with Light Family Wellness. Dr. Maxwell, thank you for your time today.
Thank you so much for having me. I greatly appreciate you having me here.
Well, for this topic today, it's what is a DPC for those that's not in this industry or know about it. It's what is a direct primary care. And before we get into that, if you would today, just give us a little bit of background. Who is Dr. Crystal Maxwell?
Awesome. Well, I originally am from Mississippi, so I'm a Southern Belle, and I've been here in South Carolina since 2010. After I completed my residency in family medicine, I went to University of Tennessee, where I did med school as well as my family medicine residency. Completed board certification, and then came and worked at a community health center in Chesterfield County for about 10 years. And after that, opened my practice in 2020 in Indian. I felt like it was good to practice where I live instead of having to travel. And we did not have a direct primary care practice here. So I said, hey, well, let me try that. I am a wife and mom. I have a 12-year-old daughter who does competitive dance, so I am always on the go. So doing direct primary care gives me a little more flexibility to be
Yes.
involved with her in school. She's in the Lancaster County schools, so I can pop over and support them as well. And so it's just been a great time since I've been here since 2010.
Yeah. Well, good. Well, you kind of touched on it just a little bit there. You are our area's first direct primary care here in Lancaster County. And for those that don't know what that is, I do, because it's talk of our industry. But what is a direct primary care?
So direct primary care is membership-based primary care services. So working directly with your physician, as opposed to going through a third-party payer for the payment of service. So it's talking about the payment model. So just kind of like you think about Netflix or having a gym membership or Hulu subscription. You may already have like a cable company that you work with, or have direct TV, but you also may have a subscription service for some additional level of services. Direct primary care is that subscription or membership based model for your primary care doctor.
Okay, that's good. Now, there's a part, and I'm gonna touch on something here. There's a part on your website that has direct access to your physician through phone, text, email, and longer patient visits, which allows a more personalized patient-physician relationship. I like that because something happened when we went to years ago when I was on the carrier side. Managed care came in. And when managed care came in, it was almost like when you went to your doctor, it was like herding cattle. It was in and out, and we lost that that time being with your doctor, and really that the doctor understanding, getting to know that patient. I like what you do. I like the option we have of spending more time. So that's an important piece of what you do, right?
Absolutely. My new patient appointments are an hour, and that's literally an hour with me, not in the waiting room, with
Mhm.
additional nursing staff. That is actually dedicated time with me and the person who is sitting before me, because particularly coming in as a new patient, you have a lot of history of things that have gone on before you've walked through my doors. And so for us to be able to go over and have that time so that we can get to know each other helps to establish that relationship of trust. And for us to work together and for you to trust me, you need to be able to tell me what's going on in an unrushed manner. And so even my follow-ups appointments are 30 minutes. And some of them, if they are more complex patients, I will reschedule them for another hour if they find it. So I have that flexibility of being able to extend those visits to make sure that your needs are being met and heard.
Okay, good. Now you mentioned it in there. It's fee based, so there's no insurance, this is a monthly fee, just depending on what you need, and that's a reoccurring fee every month.
Yeah, it's based on your age.
Okay.
If you're 23 to 64, which is my average age population,
Mhm.
it's $80 per month. If you're 65 and up, it's 90 per month. If you're 2 to 22, it's 70 per month, or 50 if you're a child on with your parent. So it's really just the age base
Mhm.
as opposed to need base. And that encompasses all of your visits with me. So there's not an additional copay when you do need to come in for that strep throat, or you do have that physical exam and you feel like I have the strep throat today and I need to be treated. We can still do all of those things in one visit, because as a member, I am not I don't have those insurance requirements of what can be done in a specific visit. We can address what you need for that particular day without additional copays.
Yeah, awesome. That's now an asterisk there. That's as of today. Those fees can change at any point, but gives you a good idea of what that looks like on a monthly basis. Also, like I said, it can change going forward. So with that model, you can do it by phone, text, email. Do you do it like we're doing it now, virtually?
Yes. We do video visits and I do text visits is kind of the new term that I like to use, because there are some things that people will say, hey, I think I need to come see you. And I'll ask a laundry list of questions, just as you were before me. And I will know I don't actually need to see you in person. We know what's going on. I know what to do. I've ruled out the red flag stuff. Your prescription is now at the pharmacy. So I do a lot of text visit, but if I feel like I need to see you so that I can evaluate how you're breathing, how you look, then I'll just text you a link or email you a link and we'll hop on just like this, and have a visit that way as well. So we, based off of what your symptoms are and what's going on with you, we make the decision of what's most appropriate. I do have some
Mhm.
people who are, I really still would like to see you, even though I know what you're saying, which is
Yeah.
fine. And so then I would say, well, that's fine, come right on in. But you don't have to leave if it's something that's minor. You don't have to leave work, you don't have to leave your home, find a babysitter. All of those things are not a barrier for you to have care when they're not, when it's not necessary.
Okay. That being said, kind of touch on some of those services. You do chronic disease prevention, physicals, those sorts of things. Kind of touch some of those highlights on what you handle.
Awesome. So your bread and butter primary care. So I'm very much into wellness, because unfortunately, most people think of going to the doctor. I go when I'm sick, but I like to hit people before you're sick. So addressing things that we can see that may be leading to something in the future. So talking about your sleep, talking about your lifestyle, talking about your work, chronic stress, things like that. So having those conversations of wellness as well. And then, of course, your chronic disease management, diabetes, high blood pressure, weight management, thyroid disorder, asthma, COPD, congestive heart failure. And then your acute care stuff, your cough, cold, sinus infections, flu, all of those things. And if you have some minor aches and pain, musculoskeletal, you think you have a sprain and things like that. So a lot of the things that unfortunately people end up going to urgent care for because they couldn't get in with their primary
Mhm.
within a day or two, I can handle those things with a direct primary care model as well.
Okay. Good. Now, that being said, how do you handle and how does you need low cost labs, medications? How does that work?
Great question. So one of the other additional benefits that people who are members of direct primary care practices have is that you have access to near wholesale pricing on labs and medications. So there's that markup process that can happen when there are third parties involved. And so for my patients who come in for acute care, there's some acute care medicines, amoxicillin, a Z-Pak, that I have already in office. If you do have high blood pressure, then there are medications, I can order those in bulk for you. So your 90-day supplies of your blood pressure medicine, you can often get for a lot less expensive than going through your insurance. So things that I can get less than GoodRx, then I can bring those here. And even like Viagra for my men is 50 cents a pill right now.
Yeah.
So looking at what is affordable without the high markups, and the same thing with labs. I've had some people who are like, well, my insurance, I have good insurance, so let me use that for my labs, and they've done it, and I've given them a quote of about $35 for their wellness labs, and then they came back and said, well, my part was still $100. I should have done it cash pay. So
Yeah.
a cholesterol panel in my practice is about $4.90. Where can you go and get a cholesterol panel for that inexpensive? And that's because we don't do the extreme markups. And so all of my patients have access to that, and we're able to talk about that during the visit. So if I'm saying that you should have these particular labs, this is how much these labs will cost. And so that right then and there, versus we order it and then about a month or so down the road, then you get your part from the lab of what your cost will be. So it's very transparent and upfront without that surprise billing.
Yeah. Awesome. That's one of the great things about direct primary care and the model you do. I mean, it's just expanded. You can do so many different things. So that is great. Is there anything else I'm not asking? Kind of what's a last piece nugget information that somebody needs to know about what you do?
Biggest thing is I take care of people whether you have insurance or not. I'm not anti-insurance. We do need insurance. We need insurance for our big ticket items. So kind of think about like your car. You have car insurance. You're not using your car insurance for your oil change or your tire rotation or your gas, right? You're paying for that out of pocket. And if you get in a collision, you will use your car insurance for that. And for here, depending on how big the collision is, you're going to decide if you actually want to go through your insurance or not. And it's the same thing for our health. There's a lot of things that we can do, bread and butter in primary care, that we can do a lot less expensive and save your insurance for those big ticket items. If you have specialists, if you have specialty drugs that you need that are branded and are more expensive, if you do end up in the hospital and need care, your insurance will still cover that. But for the other minor things, doing direct primary care can often save people a lot on their deductibles and co-insurances with having a more personal relationship with their physician.
Yeah. Awesome. Another thing here is we're going to have an ongoing topic and some different things. So definitely have keep a lookout for different topics, some different things that we're going to do going forward. So if you need to get in touch with Dr. Maxwell, her practice is Light Family Wellness. Definitely reach out to her and see what those services entail, how she can help you on an ongoing basis. So this is great. It's going to be some great information. So look forward to what we're going to do going forward with Dr. Maxwell. So again, Dr. Maxwell, appreciate this opportunity to explain what is a direct primary care and educate people on that.
My pleasure. Thanks for having me.
All righty. Well, everybody else, thank you for watching A Minute with Marty, and we're going to look forward to Dr. Maxwell and what her expertise and her topics going forward. So again, thank you for watching A Minute with Marty, and hope you have a good day. Y'all take care.